we're deeply appreciative of your sharing this journey with us into the present and the future of surgery. I would like to take a moment to ask Dr. Arthur Kellerman, our Senior Vice President for Health Sciences and the Health System, to say a few words. Art?
Good morning, colleagues. Is the sound okay, first of all? Great. I have to tell you, I am new on the job, obviously. I started October the 1st, so this is roughly the 50th, 52nd day that I've been at VCU. So I'm still very much on a learning curve, but your reputation preceded my arrival by more than a century. And the tradition that you've established in this community and in the country for outstanding patient care, innovation in surgical technique and surgical procedures. You've been trailblazers in so many ways. The research that you're doing and the incredible surgical education that you give are really cornerstones of the whole value proposition of the university to the community, to the region, to the Commonwealth, and to the country. I'm looking forward to attending and listening to this annual meeting, and I don't want to tie up your time, but I will ask 3 things from you, and I'll make an equally matching commitment to you. So first, the commitment. I commit to you during my watch as the CEO of the health system and the Senior VP for Health Sciences, and that includes medicine, nursing, pharmacy, health professions, and dentistry, as well as the Massey Cancer Center, that I'm going to give you everything I've got to take this institution, this medical center, to the next level. We're in a tough neighborhood. Many of you know, and I'm sure all of you know, that the other 2 major health systems in Richmond alone are both backed by large, aggressive, deep-pocketed national organizations that are really, really interested in market share, which means they're really interested in your patients and our patients. So we have to not only with honor and distinction meet the needs of the safety net and the poorest of the poor and the most unfortunate, whether it be from social or economic circumstances or trauma or other misfortune. We also need to provide premier elite services that no one else can match to be the destination medical center for the state. Secondly, we have a duty, I believe, an obligation to not only give skilled care, but also give care that's consistently safe. We're not there today, and unfailingly kind. And we can all do that. If we just remember everybody who comes to see you, everybody who's being rolled into an OR with that wide-eyed look, waiting for the anesthesia to kick in, is scared, wants to get better, and hopes and prays that you will be on the top of your game. So we owe it to them to do that every day. And third, that you and I need to constantly drive to get better and to champion innovation, because American healthcare is incredibly expensive. And let's face it, for a huge amount of the country, it's not that good. We can do a lot better, and we can not only do great things for the Commonwealth, but I think we can do great things for the country and, yeah, the world, because of the outreach and the connections and the example that you set. What I ask from you is absolute professionalism. I ask from you to be team players with your other departmental and clinical colleagues, nursing, medicine, allied health, receptionists, everybody. You are major role models for this medical center and for the health sciences. I ask that you do everything you can to address the critical issues that have been put in front of me by our Board of Regents and University President, which is access, patient safety, and outstanding patient experience. And we're going to have to work together, you all and me and everybody, to take this 750-bed medical center and make it run as safely and efficiently as we humanly can. And that's going to include now opening up our thinking to some additional innovations, like spreading the operative schedule. Maybe some of you come in a little later in the day and start cases later into the evening. Maybe In addition to unscheduled trauma or burn cases on the weekend or absolute emergencies, we do some elective cases on a weekend day. We've got to be open to all kinds of changes because we're not going to be able to build a tower as fast as we need to. And we're turning away today, including turning away from your skill and ability to save them, critically ill and injured or complex patients whose teams and health systems really want to get them to VCU, and we just don't have a bed for them. So we're going to have to manage each bed, each opportunity as efficiently as we can, but also as safely as we can. To do all that means that we're going to have to be courageous. We're going to have to be honest with each other. We're going to have to be willing to step up and point out and tackle repeated medical errors that never should happen and are frankly happening more often than anybody should be comfortable with. And we're not just going to have to tell each other to, quote, be more careful or to remind your colleague to be more careful. We need to design systems of care that will make it harder to do the wrong thing. For example, and just one example, I know recently we've had several episodes where the wrong drain was pulled. Well, you could say, well, that resident or that first year intern or whoever should be more careful. Or we could say, when we're putting those drains in the OR and we're doing what we need to do, we need to label them in a very unmistakable way. So the last drain that needs to come out is clearly identified to make it harder for the nurse or the trainee or somebody to mistake which one to pull and which one to leave in. I'm excited about being here. I'm honored to be a part of your team. I feel like I'm coming home to an institution after 17 years on the faculty at Emory University, where I loved Emory being on a major academic campus with cutting edge surgery, cardiology, and other subspecialties. But I was the guy who hung out at Grady, worked in the ER, all kinds of crazy hours, and partnered with the trauma team and the burn team and others. Here we have both in the same institution. We have the heart of a Grady and that social commitment, but we also have the cutting edge elite care of an Emory Plus. And I'm just delighted to be a part of this community. I'm delighted to be your colleague. I look forward to working with Vig and all of you to push the frontiers of surgery, to advance American medicine, and to give the Commonwealth exceptional care. So thanks to all of you. I'm gonna shut up, mute my mic, and listen. And I look forward to working with you in the months and the years to come. Thank you.
Dr. Kellerman, thank you for those words. And we look forward to working with you and the team to accomplish what we need to do over the next few years. Thank you very much. At this time, I would like to ask Ms. Jessica Carey to lead us on the presentation of the annual surgery awards. And I would like to also take this opportunity to congratulate all the nominees and the award recipients. Jessica.
So firstly, thank you to the committee who helped choose our winners this year. Our first award is for patient care, or excellence in patient care. And as you can see, Dr. Mike Abatanos, Michael Feldman, Amelia Grover, and Cindy Chenault were nominated. And our winner is Cindy Chenault. I'd like to read a little bit of her nomination. So Cindy is the consummate professional. She makes the discharge process flawless. She troubleshoots patient care issues on the floor seamlessly. She is a patient advocate and a valuable team member. So congratulations, Cindy. So next up, we have our Service Excellence Award nominees. This includes Jerry Van Harris, Jessica Carey, whoever that is, and Davis Roche. And our winner is Davis. So his nomination reads, Davis regularly impresses with his ability to work dynamically. Every project he gets included on is always a masterpiece in some form, from PowerPoint presentations to data collection to committee meetings. He's quick on his feet, knowledgeable in many facets, and overall has a great energy to interact with. The man is a force to be reckoned with. Congratulations, Davis. And last but not least, we have our Innovation and Impact, and Dr. Nicholas Thompson is our winner this year. So Dr. Thompson's nomination reads, Dr. Thompson is also doing incredible work on violence prevention, including developing a virtual reality program to teach behavior. His research is outstanding and could lead to major innovations that could potentially tap into global surgery programs. So congratulations, Dr. Thompson. And I have trophies and gift cards for all the winners.
Great. Thanks again for this. And now everybody in the Department of Surgery has put significant effort into all the work we do. So take this opportunity to congratulate all of yourself for all the work you've done. Now, the Department of Surgery really consists of the divisions where all the clinical work, the research and education really happens. So we created an org chart a few years ago for surgery where we put the focus really on the divisions and their role in surgery, but also created two separate groupings of education and research supported by Orbit, which is our Office of Research, Biotechnology Innovation. The administration for surgery is a very important part of our organization, but lives below the ground. So we're really here to support the clinical and the educational aspects of the department. And as always, patients are our sunshine, and funding is very important for our growth. FY20, Department of Surgery grew significantly. As you can see here, we have currently 15 outpatient clinics. We did about 400,000 work RVUs, almost 14,200 cases in the operating room. The department grew to about 270 faculty and staff, which includes 78 residents and fellows. We had almost a 30% growth in research, 200 plus publications, and our revenue grew significantly to about $61 million. And this includes all sorts of revenue, including foundation and research grants. Now, our vision for surgery is the future of surgery today. Our mission is the pursuit of excellence in surgical care by constant innovation and education to give every patient the best care. Our core values relate to how we work together to provide patient-centered care, teach, perform research and innovation. But what is very important to remember is that we are people taking care of people, and we must take care of ourselves as well as the people. So that's very, very important. And this year was significant because we created a wellness task force to help our own people. And also we created a diversity task force headed by Kwame, and an APP wellness and advancement task force headed by our advanced practice providers. So all these are very, very important for us to create an environment in which we can all thrive and succeed. And of course, we need to provide a safe and quality care. This year, there was a significant event of global scale, which is probably unprecedented in decades, where we were faced with the threat from the coronavirus. And as you can see here, that impacted our day-to-day operations significantly in March and April. Fortunately, by September, we have either reached pre-COVID levels or exceeded them in many areas. Next. This also includes our ambulatory visits that dropped, but are now back to pre-COVID levels. In fact, they're exceeding it. What is more important is that our new patient visits have continued to grow, as well as our third next available for patients is 4 days right now, which is currently the lowest for us in the department. Next. Of course, one of the most important things that we do is to create a future generation of surgeons and other professionals. So someday they will take care of ourselves. So there is an endless stream of people. We have 43 surgical residents, 11 plastic surgery residents, and 10 urology residents. Plastic surgery is now 12. We have 2 funded positions for 6 years. We have a number of fellowships for advanced training, including cardiothoracic surgery, critical care, laparoscopic surgery, and minimally invasive surgery, surgical oncology, transplantation, vascular surgery, and burn. And of course, our trainees are spread across the region as well as the country, and many are also globally situated. The Richmond Veterans Administration Medical Center is a flagship within the VA's national VA system. It offers comprehensive care, including robotics, advanced surgery, transplantation, advanced cancer care, and significant support for our educational and research missions. We're grateful to Dr. Jeannie Rivers, who is the Chief of Surgery at the VA, and our colleagues for their significant contributions to patient care education and research. Next, I'd like to introduce Ms. Katie Golub, who is the Senior Administrator for Surgery, and Dr. Marlon Levy, the Vice Chair, to take us through surgery finances.
Thanks, Dr. Kazarajan. So my name is Katie, and I'm the administrator for the Department of Surgery. For those of you I haven't met, I'll take a minute to go over our finances today. Dr. Kazarajan had originally asked me to try and make these slides funny. I'm not quite sure how to make finances comical, so I thought I'd just spend a little time explaining them and why they're important, and go through with all of you what our sources and uses of funds are and why it's important to your work. So these are our revenues and expenses. The left side revenues, the right expenses. These are how we're sourced and how we use those funds. So as you can see, a majority of our funds come through as clinical revenues. And that's why it's important, and we emphasize access and quality care and bringing patients into our system, because our clinical revenue really drives the funding that we get to support all of the other missions. And as you can see, the expenses are faculty, APP, and staff. Most of our expenses are human resources. And so again, part of our role on the practice plan and in the department is to figure out ways to optimize our revenue, grow our patient population so that we can continue to bring in funds to support our research and academic missions. This is our Department of Surgery financial dashboard. I'm just going to highlight 3 key areas today. The first is percent of new patients appointments. So as Dr. Kazarajan alluded to, that's something that we try and keep an eye on to make sure that we're really providing the right level of access to our patients and bringing them into the system. We'd like to see this continue to grow by new models of care, working with our providers to look at their clinic templates or how our advanced practice providers are supporting our overall clinical practice. The other 2 I'll point you to today are our payment per work RVU and our expenses per work RVU. So when we look at what we're bringing in per work RVU that our faculty and APPs have, the net patient revenue is obviously lower than our expenses. So again, when I'm working with you all on how can we be more productive, how can we optimize our billing, it's really to grow that number and try and drive our net patient revenue per work RVU to close the gap between the revenues and expenses. And this is our finance and billing priorities for this year. As many of you may have heard, we're partnering with Ensemble to work on our revenue cycle, which we're excited about in the Department of Surgery. We think there's a lot of opportunity to reduce denials and optimize coding. When we meet on a monthly basis with the division chairs to go over our billing and revenue cycle opportunities, this is where we see that the work you do is unique. It's something that you have an expertise in that we need to make sure that translates into the revenue that we're getting into our system. We also want to support your growing clinical programs, research, education, and clinical practice. And so to do that, obviously, we need the funds coming into the department and to the health system to be able to continue to grow and provide the level of care that you'd like to. Next, I'm going to pass it over to Dr. Klausner to talk about research.
Hi, good morning. My name is Adam Klausner. I'm a urologist. I'm also the Associate Chair for Research, along with my co-chair, Dr. Marty Mangino. And we work with our administrator, Amanda Jabri, as directors of the Office of Research. It's called ORBIT, for those of you who don't know, which stands for the Office of Research, Biomedicine, Innovation, and Technology, or ORBIT. And we're an office that is embedded within the department to provide services for you in any of those research needs. We do want to make a mission this year to try to meet with the divisions and let you know what resources and opportunities we have available. So I just want to highlight some of the accomplishments and ideas of the ORBIT office. We have multiple trials or projects that are funded that are either in development or already in progress, as you can see on the top left. Our FACR, which is the how much money from indirect costs from these funded programs comes back to the department, has steadily increased since the inception of Orbit in 2017, and you can see that on the bottom. And our priorities for the fiscal year of 2021 include to increase our funding, especially our NIH funding, because this is how departments of surgery are ranked based on their NIH-funded research, to create and develop a certified good laboratory practices lab, which will provide a revenue stream as we can provide core facilities to make animal models for other departments, even other institutions and industry that will provide a steady stream of revenue for the department and really self-fund our research infrastructure. We also have a priority to really increase recruitment for PhD scientists and researchers that would help supplement what we do clinically and in our education mission. So next slide, please. So on the left is a picture of the construction that's going on for our funded Sanger 9 Surgical Innovation Suite. This will ultimately be a state-of-the-art laboratory facility. Dr. Marty Mangino is directing the whole operations. We've raised more than $5 million of private funding to help start the project, which will be estimated completed in March of 2021. And so we're going to use this facility to attract the best talent for research in the world, and also to provide some core facilities to improve our revenue funding. So that's where we're at for surgical innovation for the Office of Research, and I thank you for your time.